There are a number of methods of finding the left adrenal which are discussed in the Finding the Adrenals DVD. We will discuss the left lateral sagittal method in this DVD. We will use a 16-pound cat for the left adrenal. Remember to keep the organ centered on the ultrasound screen to reduce artifact. This is best accomplished by holding the transducer perpendicular to the patient's body and the organ of interest. Adjust depth to fill the ultrasound screen with the organ of interest if possible. If needed, adjust transducer frequency for the current depth. Adjust gain for the best image. And adjust focal points to the bottom of the organ of interest. Remember to keep one finger of the keyboard hand on the freeze button, ready to capture the best image. When you press the freeze button, practice leaving your transducer hand relaxed and in position so that when you unfreeze, you will still have the same image. This will save you time and effort. When finished with the left kidney, the transducer is in a left lateral sagittal position bisecting the left kidney. Slide the transducer to the cranial pole of the left kidney to reduce edge shadowing. Fan very slowly ventrally and, if necessary, dorsally. The aorta and left adrenal gland should appear on the screen just cranial to the cranial pole of the kidney. Adjust depth to magnify the adrenal gland. Sometimes the use of color flow Doppler will help you find the aorta and left adrenal. The adrenal gland will not show color. When possible, apply transducer pressure to place the transducer closer to the adrenal. Adjust depth to magnify the adrenal. Press the freeze button, use cinematic loop to select the best image, measure the width of the cranial or caudal pole, label the image, and save to the patient record or archive. In dogs and most cats, the normal left adrenal has a peanut or dumbbell shape. In some cats, the left adrenal appears as a single nodule. Sometimes a separate cortex and medulla can be seen. At other times, the adrenal may appear evenly hyperechoic or hypoechoic. Look for lesions of excessive size, smaller than expected size, abnormal shape, hyperechoic nodules, hypoechoic nodules, and invasion into the aorta or other blood vessels. Examples of these lesions are shown in the Adrenal Disease DVD. In the left lateral sagittal position, the left adrenal is usually found between the cranial pole of the left kidney and the aorta. Intestinal gas or masses may block your view of the left adrenal from this position, and another method may be needed. Mineralization of the adrenal can be normal in older cats and will result in an acoustic shadow. This video shows a mineralized tumor with an acoustic shadow of the left adrenal in a dog. In dogs, mineralization of the adrenal usually indicates a tumor. This is a 14-year-old neutered male corgi weighing 35 pounds. Adrenal glands are measured by width of the poles. If both poles look the same, you can measure one or the other. The maximum adrenal width for a large dog is 7.4 millimeters. Because of the wide variation in dog size, there is no standard table of adrenal size for dogs. In cats, adrenal width is usually 4 to 4.6 millimeters. Borderline measurements are probably normal.